assessment fee. We'll give folks another minute or so to come in from the virtual lobby and we will get started. Okay, I think we do have critical mass. So good morning again, everyone. This is Chicky Flowers. I'm the administrator of the Oregon Health Insurance Marketplace. Thank you for joining. Thank you for joining today's session or consultation meeting with the Health Insurance Marketplace Advisory Committee for our proposed 2023 marketplace assessment fee. And this is the fee that we do charge our health insurance carriers on the marketplace that help fund our expenses for the Oregon Health Insurance Marketplace. Before we get started, I would like to call roll for current members of the Health Insurance Marketplace Advisory Committee, those actively on roster as of February 17th. And I have to specify that because I know we have folks who are leaving and folks who are coming on board. So as of today, we still have our most of our members from the last term. So let me get started by Craig Anderson.
Here.
Shauna Butler. Deanne Field. Maribeth Borino.
Here.
Jim Hauser.
Here.
Kathleen Jonathan. Sean McAnulty. Ken Preventure. Shannon Saldivar. Lindsay Shirahama.
I'm here.
Andrew Stolfi. Okay, unfortunately, we do not have quorum to pass at this time, but hopefully in a couple of minutes they will join. So, but let's get started though for the memo that Justin Fuller, DCBS economist, senior economist, has put together for us. So as a quick overview too, part of, right, as we all know, Senate Bill 65 moved the Oregon Health Insurance Marketplace over from DCBS to OHA. And as part of that transition, of course, there's a lot of different projects and tasks and so on and so forth that we've had to transition. And thankfully, DCBS and Justin has agreed to take this project for now and train our HPA staff in the meantime. So it's a transition period for us. So Justin, if you are ready, please go ahead and share your screen and get us going. Housekeeping item, if you are not speaking, please make sure to check that your laptops or your other devices are on mute. Thank you.
Awesome. Thank you very much, Chicky. So basically starting on, my name is Justin Fuller. Like Chicky said, I'm the senior economist at DCBS. This is about the third time we've done this together, and it went relatively straightforward this year. So if anyone has questions, please feel free to interject. I'm more than happy to answer what I'm able to. And if I'm not able to, I'll just ask you to politely please wait while I go find the information and get back. So starting on page 2 of the memo, the top table shows the historical marketplace assessment rates starting in 2014 through 2022. In 2022, they are $5.50 per member per month for the medical assessment and 36 cents per member per month for the dental assessment. Given our projection for enrollment in 2023 and how much we think the marketplace is going to spend in 2023, we anticipate that the per member per month for medical is going to be, would need to be $5.53. So to fully fund operations in 2023, it doesn't look like the medical per member per month assessment rate needs to change. And I like to start at the end. So stepping into that a little bit, I'm going to discuss the expenditure assumptions in 2023, and then I'll discuss the enrollment forecast in 2023, and then I'll also talk about where the marketplace is in terms of their assessment rate cap. They can't set the assessment rate at more than 5% of the average premium. I'll also discuss the assessment cap, or excuse me, the fund balance cap, which is 2/4 of expenditures. And then I'll briefly go over the financial outcomes of these forecasts. So our current expenditure forecast for the marketplace is based on their budgeted expenditures from the legislatively adopted budget for 21-23. This covers fiscal year 2022 and fiscal year 2020. Oops, I'm not zooming. There we go. So you'll notice that marketplace expenditures in fiscal year 2022 and 2023 are both about $7.9 million. This is half of their budgeted expenditures. Not included in their budgeted expenditures are shared service costs. Shared services is what DCBS calls them. OHA calls them, and please correct me if I'm incorrect, OHA calls them shared assessment and enterprise-wide costs. We anticipate that the budgeted expenditures are about $15.8 million, and these shared service costs are about $1.5 million. Carrying this forward into the future, into fiscal year 2024 and after, we basically assume that expenditures increase by 3% per year. And going along with that, OHA believes that the shared service costs will be about 30% of payroll costs. So these shared costs are also growing by about 3% per year. None of these costs include the Senior Health Insurance Benefit Assistance Program or the COFA Premium Assistance Program. There is, if you look at the history here, a fairly large jump between fiscal year 21 and 22. A lot of this is accounted for cost-saving measures that the marketplace put in place because it wasn't clear how COVID was going to affect their revenue streams. Excuse me, I have a bit of a cold, pardon. So for 2023, we expect the marketplace needs to spend about $8.5 million to fund their operations. So going on to our enrollment forecast, the thick black line here is medical enrollment in calendar year 2021. The non-bumpy series, the blue, the red, and the green, are enrollment from 2018 through 2020. You'll notice there's a pretty distinct decrease in monthly enrollment in those 3 years in 2018 and 2019 and 2020. And that's largely due to when open enrollment ended. It ended soon enough the prior calendar year that you don't see any increase early in the year like you do see in 2022 and 2023. 2021's enrollment pattern is largely impacted by COVID-related special enrollment periods and premium support programs. So you can see that for 2022, which is this bumpy light blue line, that we expect enrollment to peak in March and then basically reduce at the same rate as it has historically. These two, the two forecasts are based on 2016 and 2017 enrollment patterns because they shared a similar closing to the open enrollment period. So if you apply the $5.53 per member per month against these forecast enrollments, you basically end up with all of your expenditures paid for. Are there questions on that? Anyone? I'm told I need to wait a minute.
Yeah,
But
please
we
do. Craig, I think, has his hand up. Go ahead, Craig.
Yeah, thank you. I'm a little slow here. Thanks, Justin. This is good. I would have a question about 2022 specifically and the Medicaid population and redetermination that's imminent. We're expecting at the end of this year, I think, sometime in the fall, maybe. So was any of that taken into consideration? People rolling out Medicaid rolls?
So the only thing that goes into our forecast, no, it doesn't, to answer your question directly, about the only thing we see going on with this forecast, and this is part of a data availability issue to DCBS. Our forecast is largely based on, we have January and February enrollment already, and so we just apply the historical month-to-month development at that point. After 2022, we do two things in this case. We apply the under 65 Oregon population growth, and then as just a way to control for some of the uncertainty in enrollment, 2023 and 2024's enrollment were reduced 5% each year after that. And that's a process that we've gone through, our practice we've used for the last several years in determining our enrollment forecast.
Okay, and is it accurate to say by reducing enrollment, we're being more conservative in a sense?
It is.
Okay.
It is.
Okay. So
yeah, excuse me for interrupting you. From a marketplace revenue standpoint, we've never really seen this level of decrease from year to year. So it is a very, very conservative assumption to build into the model. Yes.
Okay, thank you.
You're welcome. And I can't tell if anyone else is raising their hands. I don't know how to.
I'd be happy to let you know, Justin, if there's anybody who has their hands raised, their virtual hand raised. So actually, if I can just supplement what Justin said, we decided to go with a conservative estimate for enrollment this year with, well, of course, because we still don't know if the ARPA subsidies will be extended. I know, Ron Gallinet, you sent me an email about it, and my apologies, I didn't get a chance to respond to you. As we all know, ARPA subsidies expanded to 400% FPL and above, which is fantastic. It is, however, set to end as of now, at the end of this year. It's one of those policies that have been proposed in the Build Back Better Act, which we don't know if it's still alive or if it's truly dead. But it is one of those that I know our delegation, it's very important to them because it has increased subsidies for everybody, as well as increased our enrollment. So that is also one of the reasons why we decided to go with a conservative model for enrollment. And Justin, no, I don't see any other hands raised.
Okay, fantastic. Thank you very much. So forecasts are never correct. This table shows, and I don't know if you can see my pointer or not, but across the top center where it says per member per month assessment rates, those are different modeled rates that could be implemented. And across the vertical axis where it talks about the medical enrollment forecast, our baseline forecast is the center one, where the forecast is equal to an average monthly enrollment of for medical plans of 128,250. That produces all the way over on the right, the $5.53 equilibrium rate. So looking towards the exact center, when you go down from the $5.50 per member per month assessment rate to the forecast equals 128,250, you see that raises $8.5 million. If we're incorrect in our enrollment forecast, and the forecast is instead 10,000 higher, that would bring in $9.1 million. So you just go up 2 from the 8.5, and that would set the equilibrium rate down to $5.13. And this is just provided as a way for folks to measure, you know, the scale of the outcome of forecast errors. So there's that. And this is a complicated table, so if anyone has trouble, please let me know. But yeah. Moving on to the statutory cap on the marketplace account balance. So the marketplace is statutorily obligated to have no more than 2 quarters of expenditures. So at the end of each biennium, the marketplace goes through a process of looking at their existing fund balance and needs to determine if a rebate for the following calendar year is required. The marketplace did this a few months ago, and they are currently crediting carriers about $371,000 per quarter, or about $1.48 million over the entirety of calendar year 2022. Under the assumptions that we've talked about, the enrollment and the expenditures, we don't anticipate that a credit would be required in calendar year 2024. Oh boy, this is. My apologies for the small print. The marketplace is also prohibited from charging an assessment rate that is more than 5% of average premium. So right now in 2023, we assume that we estimate that the assessment rate at $5.50 is about 1% of average premium. The dental rate here is also about 1% of average premium. Now, the thing the marketplace has done in the past is that they have also included the federal technology charges in this. And once you include the federal technology charges, which are planned to be about 2.25% of premium, the total per member per month charge is about 3.2% of average premium, which is still well below the 5%. And we don't anticipate it really going up anywhere close to that 5% anywhere through 2026. So once you take all this together, the marketplace had a $5.7 million ending fund balance at the end of fiscal year 2021. We anticipate that to be somewhat stable through the near term and then decline starting around fiscal year 2026. And this is largely due to the assumptions about the 5% reduction in enrollment in those further out years. So with that, that's the end of my spiel. I'd be happy to answer anyone's questions. Oh, good. I was worried that I had dropped like 3 minutes ago.
Nope, we're still here, and I'm sure everyone's processing. In case you have your screen in front of you and you need bigger, a quick trick that I've learned in the last couple of weeks is if you put your mouse over there and then do the press control down and then scroll up with your mouse, that increases the size significantly for you. Oh, there you go. You also have it in your appointment invites, as well as the Dawn shared it in the chat. So today the ask is for you all to provide us with your go or no go with our proposed 2023 rate of $5.50 per member per month on a medical rate, and 36 cents, I believe, right, for dental. It is the same rate we've had in 2020 for this year, 2022, as well as in 2021. We have been fortunate enough that enrollment has been stable despite the changes in the federal environment, as well as we have also been we've been very judicious with our expenses. It's been a very different last 2 years with how we've had to spend our how we've had to do our operations. So because we've had to curtail our operations a lot, you normally will see us out more in the field, doing outreach and education, really traveling all over the state. We haven't been able to do that because of the pandemic. So of course there is that's both a positive and negative. Positive in the sense that we've been able to generate savings, but we also haven't been able to go out in the field as much as we would like. So I think there is a question from Andrew Tarab. Andrew, go ahead.
Good morning, everyone. Justin, you in the memo you noted that you found the forecast to be fairly conservative, the membership forecast. Do you mind? I mean, you brushed on this briefly, but do you mind if I ask? Could you possibly quantify what a center point forecast would have been then? If you know that it's fairly conservative, could you guide us back to what a center point would be? And I know, because I'm just thinking about the table that's below that, you provide the simulations. I'm just trying to get my head around what would the forecast, the PMPM assessment be at a more center point?
Certainly. Yeah, certainly I'd be happy to. I'll share my screen again. So what our I'll call it risk adjusted forecast is essentially producing is, or we base it entirely on Oregon population growth under 65, which is between 0.2 and 0.4% per year. So what ends up happening is this 2023 forecast and 2024 forecast are basically all on top of this 2022 forecast. And where that ends up getting you is, I'm gonna look at something really quickly. And that increases revenue in fiscal year 2023. It's a difference of about $200,000 in fiscal year 2023. The non-risk adjusted forecast is $8.26 million in fiscal year 2023. And the risk adjustment, this lower enrollment forecast, is $8.03 million in fiscal year 2023. So it's not a particularly, well, I mean, I'm talking about other people's money. So to some folks, it may very well be a fairly large difference, but we don't see much of a difference in terms of the financial outcome of that. It ends up being fairly close to the low enrollment forecast.
Thank you.
Yeah, of course. Thank you.
Any other questions from the committee members? Okay, seeing none, prior to either voicing your support or voting yay or nay, I would like to pass off the mic to Victor Garcia to go over a quick overview of the rulemaking process and the next steps. So Victor, if you're ready.
Sure. I'm gonna see if I can share my screen here. So my role in this ordinarily at DCBS was as a rules coordinator. In order to have the assessment be in place, we file a rule with the Secretary of State every year. We do this rule filing whether the rate changes or not. So it ends up being sort of a running record of every year's assessments and the results of those assessments in our rules. Our rules are OAR 945. That's the rule set for the marketplace, and specifically for this, it's 030. 030. Something or other. Yeah, I can go over that in a second when I share the screen here. I just wanted to give that context. And so in order to complete the filing process, we have to collect some information and kind of run it by the advisory, make sure you're either in agreement with what we've assumed is the case, or if you have any additional information to add to provide that. Since I'm no longer officially the rules coordinator, this will be information I pass along to Pete Edlin, who is the HPA rules coordinator at OHA. And there are some additional things, just one or two additional things that is now being collected that wasn't previously. So I would want the committee's input about that. So with that, I will share my window. Okay, and hopefully everybody can see that okay. And I'm now no longer able to see faces or hands. So if anybody has any questions, just let me know. So starting with the statement of need and fiscal impact, this is where we explain what our need for the rule is. And I'll zoom in on that a little bit. So a couple of changes. Ordinarily, this would have said DCBS. This now says Oregon Health Authority. We also included Senate Bill 65 from 2021, as I'm not sure how much has made it into our statutes regarding these rules. So having them both together, we'll reference those in the rulemaking. And the actual rule is 945-030. 0030 for folks who like to look up the nuts and bolts of our administrative rules. And just saying that we anticipated maintaining the assessment of $550 a month per member per month for the health plans and 36 cents for standalone dental plans. So that's just explaining why we're filing the rule. And I'm giving a little extra context over what we ordinarily do, just so that the OHA folks can see how we normally do it. So if they want me to change how I do this, they can also let me know, or if they have any additional information to add. So documents relied upon, that just explains on what we're relying on for authority and anything else related to the rulemaking. So that's all mentioned in the filing. Something new for this year is a statement identifying how the adoption of the rule will affect racial equity in the state. We haven't actually developed like a statement regarding that. We will, but I figured this would be a good time to collect any information from the advisory committee that they might like to add or see addressed in this statement. Again, since this is new for us, we hadn't really assumed anything here, and I thought it might be better to see if the committee had an opinion first before we created something. So I'll just pause for a second and see if anybody has either anything to say about that or any questions about that. Okay, well, seeing none, I will, in that case, once we put something together, we'll send that out to the committee just to get an opinion and make sure that we're not saying anything unexpected. I don't expect there would be a whole lot there, but it is important to address, and we want to make sure we give it the attention it needs. So moving on to the fiscal and economic impact, just a brief explanation of how the assessment funds all of the marketplace's operations, and that basically during this assessment process, we're, as Justin explained, kind of aiming for the best sort of balance for neither a deficit or a necessary surplus in our, we have no incentive really to have extra money because we essentially have to give it back if we have too much. So the reason we end up a little on the conservative side is that a small surplus is much easier to deal with than a budget shortfall. But also having no idea what the future actually holds in that crystal ball is why we tend to lean a little more conservative there. So since the proposed rates for 23 are the same as they were in 22, there's no expected fiscal or economic impact to other parties or stakeholders other than the marketplace resulting from this amendment itself. So amending the rule essentially to keep the rates at the same should have no economic impact that we can identify. So I'll just pause there. Again, we kind of give a sort of a surface view or a quick context of kind of what our rate is and how we get to it, and then what we predict this time around will do specifically. So are there any questions there? And again, I can't see hands or comments right now because it's hiding that from me, but okay. And then the next part is the statement of cost of compliance. This is the Secretary of State and the filing process trying to gather information about how we perceive this to impact our stakeholders, parties external to us, and have us evaluate that based on a few questions. So the first question is to identify state agencies, units of local government, members of the public that would likely to be economically affected by the rule. So we just sort of restate some of the things we have already in the filing, which is we don't really anticipate that there would be any impact to state agencies, local government, essentially any parties outside of the Oregon health insurance marketplace itself. And then OHA is now the agency that we are under. So OHA is proposing the rates based on our economic models and budget projections. But explaining that the marketplace assessment is paid out of the premiums of the individual health insurance plans purchased through the marketplace by Oregonians. So in that respect, there is generally an economic impact just having an assessment, but this amendment itself doesn't change anything. So nobody should see what they are paying go up or down from where it is now. So we would see that as a, no economic impact related to this amendment specifically. And this is, an effort to be as transparent as possible and as concise a manner as possible. So, and then the second question is regarding primarily small businesses and making sure there's no additional costs or burdens administratively foisted upon small businesses by anything that we're proposing. We have not really ever been able to identify anything specifically that impacts small businesses directly from these rulemakings that we have regarding the assessment. So that's what we say in here, and that there's no additional, equipment or administrative work that has to be done for small businesses to comply. That being said, ordinarily, we would just say that we've had small businesses involved in the rulemaking because we've had a representative of small business on our committee for a while. I did want to kind of ask very quickly again, because I'm not sure where we're at that. Normally we could point to sort of Jim Hauser. I know Shannon and Shauna are both kind of agents that could be regarded small businesses as well, but wanted to see if there was any input from any participants right now that could speak to small business interests with regard to our rule, just in a interest of being complete. Are there any questions about that or any comments from anyone? Okay, great. In that case, that kind of wraps it up for the parts of the rule that we have to put together to submit this statement. We'll fill in the other parts as far as the hearing date, the time. Ordinarily, we'd have the hearing sometime in March, and the director will reach a sort of a final decision on the rates, approving them, and then we'll do the final filing at some point after that. So all that information will go out in this notice of the hearing, which we should expect to go out within the next week or so here, and that gets kind of broadcast widely to folks on our sending list through GovDelivery. So that's about it for this sort of technical part. Again, any questions, let me know now or later.
Thank you, Victor. So any other questions from anybody or feedback or other information that both DCBS teams and OHA teams would like to share with the Health Insurance Marketplace Advisory Committee, both incoming and outgoing members? This transition has a lot of people involved with this particular project, so we appreciate everyone's flexibility in learning something new and passing off information as well. So thank you in advance. And if we're ready, we can go into a vote. Okay, and we do have quorum from the existing committee members as of 2/17/2022. So thank you so much for those who were able to join. But I also want to recognize that we have a lot of our new incoming members. They will be starting March 1st. So if you wouldn't mind, I'd also like to call on you to share your vote of support or no support for this proposed rule for our marketplace assessment for 2023. Of $5.50 per member per month for medical plans and 36 cents for dental plans per member per month. So let's start with Craig Anderson.
I'd like to vote in support. Thank you.
Thank you, Craig. Jim Hauser.
Excuse me, I vote in support.
Thank you. Lindsay.
I vote in support.
Mary Beth Guarino.
I vote in support.
Ron Gallinat.
I'm in support.
Shannon Saldivar.
I vote in support.
Andrew Stolfi.
I vote in support.
Thank you. Gladys Boutwell.
In support.
Paul Harmon.
Support.
Holly Sorensen.
I vote in support.
Lindsay Hopper.
In support.
Sakinai.
Support.
Thank you very much. Andrew Tarab.
I vote in support.
Unanimous decision, everybody. Thank you so much. So next steps, as Victor said, we will be filing our rule and getting that finalized. And Anthony Behrens, our carrier liaison, will make sure to communicate that with the health insurance marketplace carriers as they work towards rates and filing, which I'm sure they're very, very busy with already for 2023. With that said, thank you so much, everybody, for spending 40 minutes of your Thursday morning with us, and happy to give back time. Thank you, Justin Fuller, Carolina Marquette, and the rest of the DCBS team for putting this together and working with us for this for the last few years. We really appreciate the support and the help, and looking forward to, I would like to introduce you actually real quick to our OHA team. We have Liz Mill, Matt Betts, Caleb Lavon. I'm hoping I'm pronouncing your last name correctly. And I believe that's everybody on the list for OHA. Looking forward to our next year's assessment rate where the OHA team will take this on. Again, thank you so much, everybody, for the teamwork for the marketplace assessment rate for 2023. Thank you and have a good day. Bye, everybody.
Take care all.